Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today I'm going to be talking about why more and more patients are preferring clear aligner therapy over conventional braces. Let's start. So today I'm going to be talking about why more and more patients are actually now switching over to their preference of braces to clear aligner therapy. Now I'm going to be talking about Invisalign as a brand, but I'm not here to promote the brand per se, but since they've been the stalwarts in this industry of clear aligner therapy and they've been the pioneers in this field, I'm also going to give them a special mention because as to how they operate. Now coming to braces versus aligners, I've already created an episode in the past about this, but I'm going to talk about why most of the people are trying to switch over. See, braces in the most gold standard are the best way to actually go for any sort of malocclusion treatment, be it individualized tooth movement, rotations, torquing, derotating and all those things, but they come with a lot of sets of terms and conditions and even some sort of side effects such as patient discomfort, gingival inflammation, lack of proper hygiene, and if in cases where these things are actually not taken care of, it can cause some serious complications such as bone loss and other complications. So that's why once someone goes for braces treatment, they have to be first educated very well in order for them to understand that these are the things that you need to be careful. You need to maintain proper hygiene, you need to take care of your diet, you can't have sticky things and all that. And that's where clear aligner therapy is much better because of the fact that the patient discomfort and acceptance is much more in aligners. Now coming to what is the cardinal difference between braces and aligners. Now braces are used as fixed mechanical therapy where the individual tooth movement is stressed upon, and the basic nature of action of braces is actually pulling action. Invisalign or clear aligner therapy basically talks about the push motion of lighter, gentler forces on the teeth so that the patient does not feel that kind of discomfort. Now when it comes to why people have started preferring clear aligner therapy over braces is because of the fact that there are a fewer less clinical emergencies when it comes to clear aligner therapy compared to braces, because if in braces you can have the loss of a bracket, you can have the breakage of a wire, and that can cause a lot of discomfort and pain and even some sort of laceration to the patient, which can cause them a lot of discomfort. When it comes to aligner therapy, since it's based on the compliance of the patient and they are removable, so you have to remove your aligners whenever you're eating your food or whatever thing that you're consuming. That way it kind of does not have those restrictions when it comes to the similar restrictions that you have with braces, because you can remove your aligner and you can eat whatever you want. So there is not a diet restriction when it comes to aligners. You just have to remove them and you can eat them. Secondly, definitely nowadays what we have seen is that especially with brands like Invisalign, there is a computerized precise treatment plan that is seen. They have a smart ClinCheck. Now what happens in a ClinCheck is that once you take a scan, you take an intraoral scan now, which is very precise compared to any sort of conventional impression method, and what happens with that is because of the computerized algorithm, you can run a simulation. So the patient already knows at the first appointment, once the scan has been done, that how their teeth are going to be looking like with the most realistic expectations that you can put forward when it comes to clear aligner therapy. And also those small nitty-gritties can be talked about because of the algorithm, which is based on so many data points and so many years of research that it is very accurate and precise. Now with braces, it also depends upon the clinician experience. At the same time, it also depends upon how the patient is maintaining the oral hygiene. Compared to braces, when it comes to aligner therapy, you can practice your oral hygiene by just taking them off and you can do your regular brushing and flossing and whatever that you need to do. Secondly, it has been found in studies that the periodontal health, when it was checked between braces patients and aligner patients, at the end of 12 months, the aligner patients actually had better periodontal health. That means the movements were not causing abnormal bone losses. It wasn't leading to facilitation of plaque formation, and that's where oral hygiene maintenance was much easier in Invisalign patients and aligner patients. Now there are a lot of brands that we can talk about when it comes to aligner therapy. But one particular brand that I would want to talk about is Invisalign, because of the fact that this is the pioneer brand when it comes to clear aligner therapy. They have some proprietary features which are amazing in terms of their smart track material. The material is very different from and much better than most of its competitors in the market, since they've been there since for a very long time. They've done over 11 million cases worldwide, which have been beautifully documented. They have a gallery online also, which is open for everyone to see. Secondly, what you need to understand is that they are using smart ClinCheck, which is algorithm based, so you get more predictable results, and you already know as a patient that what is the tentative time of your treatment to be elapsed. So that way, a lot of patients who are bound by timelines, let's say brides to be who have some special day or pageants, who require that kind of alignment before they reach on that particular fateful day, you have already that timeline with the treatment plan as to what needs to happen. Now, there were some limitations before when it came to clear aligner therapy regarding specific movements such as derotations, such as intrusions, such as buccolingual inclinations, because tipping can only be done when it comes to aligner therapy. However, now they've come with proprietary alternative geometries. That means they have come up with features that are incorporated in the material, such as bite ridges, bite ramps, and lingual torquing features as well. So these things, they are incorporated in the aligners itself, and that's where you can go for complex cases. Initially, it was thought that aligner therapy is better for non-extraction cases, which are mild to moderate malocclusions. But nowadays, because of these new attachments, these new optimized attachments, which can facilitate individual teeth movement within the tray that is aligned in that material, which is a thermoplastic material, the aligner material, you can have similar results of that of the braces without the discomfort, without the pain, without the inflammation, without the compromised oral hygiene because of plaque accumulation. So that way, aligner therapy is much better when it comes to cases. Mostly, I'll be very realistic, it's always better to go for aligner therapy first of all if your case is mild to moderate and does not require an extraction. That's the best case scenario if you're going for that. If you have a particular timeline, it's the best scenario. On top of that, when we talk about the biggest problem that people as patients face is the commercials. Now, albeit definitely braces are much cheaper or inexpensive compared to aligners, but despite the fact that the aligner costs quite a lot compared to braces, if you see the value that they bring, the patient comfort that they bring, and even if you see the treatment time that is required for the thing and you divide the whole lump sum of the money with the number of months, it comes out to be not much. It's almost the same as your other things. The only thing that is required from the patient is that whatever we are telling you as instructions when it comes to aligners is your compliance. When you have to wear them, when not you have to wear them. You can't drink anything hot because these are thermoplastic materials, so they are susceptible to thermal damage. They are susceptible to mechanical damage if you're biting on food with them and all that. And there's a particular way of inserting them and removing them. And there are some procedures that are required in aligners which a lot of doctors generally tend to skip telling the patients, such as interproximal reduction. Interproximal reduction is removing a little bit of the enamel from the adjacent side of teeth so that we can create spaces, and there can be other things as well, right? You can use other optimized attachments for that, and these things will require the counseling of the patient with the help of the doctor. And last but not the least, which is common to both braces and aligners, is the retention. Retention means once you have reached your particular state of occlusion and you want to retain it, please don't think that after aligner therapy is over, you don't require retainers. You require retainers, and you get good retainers as well. You get good retainers which can be worn, and you can wear them for quite a good time, and you can taper down the time as the time progresses and your teeth get aligned to the new position that they've come to gradually from their previous position. And it's very important for you to understand that as a patient, we have to see 3-4 things. The complexity of the case, that will be taken care of by the orthodontist or the dentist who's providing you with the aligner therapy. Your perspective or your understanding of what you want as a result. You want function, you want aesthetics, and definitely the financial aspect of the treatment plan and the costing, because the more severe the case is, the more number of trays would happen, and that's where the commercials would go higher. So you have to take this call as a patient, as long as your pocket allows, and it also depends upon how much severity of the case requires more number of trays. And the treatment can go on from 80,000 Indian rupees to around 3.5 lakh as well, depending upon case severity and the duration of the treatment plan. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp, and in a couple of days I will get back to you, and then we can have a chat. Kindly be patient, do not call me directly, and if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.